Dear colleagues, I hope you hear me well, as well as in English channel. The presentation slides will be also presented in both languages, but we will provide instructions in our chat box before the first presentation. So, as it turned out, today, the 25th of February, is a very popular date. Maybe it is just a beautiful date. And several big events have been planned in our region, and our team is very thankful to you. And we hope that we will not intersect in time. And we are thankful to you that you joined our webinar, and in the coming an hour and a half, we will spend it together. Dear colleagues, once again, you're welcome to our regional webinar about measurable engagement of CSO and civil society in TB response, which is implemented with the financial support from UNITAID and within the program against DRTB. In the recent years, it was recognized that donor activities are not enough, and communities affected by TB play the key role in the patient-oriented services to support treatment adherence and to ensure positive political decisions. European Coalition on TB, TB Europe Coalition, is in the front line of these activities and also contributes to the decision-making related to these issues. And in this context, it is as important as never before to provide specific and concrete data to inform decisions and program policies. And for this purpose, in order to measure the impact of communities and civil society organizations, the WHO developed 4 indicators for the European region. These 4 indicators help to show the scale and engagement of civil society and communities in response to this threat. These 4 indicators provide a qualitative approach to measuring the engagement of communities and provide the measurable impact, data on measurable impact of communities. And we are talking today about these 4 indicators, how to embed them into routine monitoring, how to build partnerships. And we will talk about all these issues and other issues during our today's webinar. I wish you all a fruitful meeting and a lot of success. After today's webinar, we share all the available materials, presentations in Russian and English languages. We have planned 2 sessions, Q&A sessions, within this webinar where you will be able to ask questions which are of interest. You will also write your questions in our chat box, but please specify your organizations and names. Also, during the speakers' presentations, please switch off your microphones and do not share your screens. And before we switch to our first presentation, a short instruction how you are able to view these slides in the language which is convenient to you. If you would like to see the presentations in Russian or English languages, you can select presentation in English or presentation in Russian. And so you will have an access to the presentation in the language that is comfortable for you. Also, you can see the detailed instructions in the chat box. But if you have any technical issues with this, please write about them in our chat box and our technical team will help you. And now I am giving the floor with the greatest pleasure to Georgi Khuchikhidze, an epidemiologist of the Department of Antimicrobial Resistance and Epidemiology in Georgia. Georgi, in his presentation, will talk about the partnership which is embedded in the system, about the involvement of civil society and local communities in TB response, and tell you about the indicators of European WHO and their implementation at the local level. Georgi,
Thank you.
you are welcome.
Thank you very much. Hello, everyone. Good morning. Good afternoon. First of all, I would like to thank the organizers for inviting me to speak and for organizing this meeting. Today, I will speak about how civil society and community engagement are embedded within the TB response, particularly in the WHO European region. And this is not just about participation. It's about meaningful engagement that is measurable, funded, and integrated into national systems. And I will briefly cover the global framework, relevant WHO guidance, indicators measuring meaningful engagement, regional monitoring framework, and data collection tools, as well as challenges associated to data collection. Next slide, please. Let's start with the global framework that sets the foundation. Community engagement is not optional. It's part of the NTP strategy. And the NTP strategy clearly highlights engagement of communities, civil society, and both public and private providers under Pillar 2 of the strategy. And it says that countries must collaborate across ministries with affected communities, with civil society, with private sector and partners. And this reflects a shift from purely biomedical approach to a people-centered approach, and TB cannot be eliminated without those most affected being actively involved in the process. So the engagement is strategic, not symbolic. Next slide, please. So to operationalize this, WHO developed specific guidance. There is a dedicated guidance on engagement of communities and civil society to end TB, but community engagement is also integrated into consolidated TB guidelines and operational handbooks, and specifically in Module 4, which is about treatment and care. And these documents move from principles to implementation, and they clarify roles of community health workers, psychological support, adherence support, active case finding, and importantly, they promote integration into national TB programs rather than parallel systems. Next slide, please. But guidelines and guidance alone is not enough because meaningful engagement must be measurable. So in the guidance that I mentioned on the previous slide, the very core one, there are a number of indicators that are available to measure the progress at the global level. So these are the basic indicators that are recommended for countries to use to measure the progress. Indicator 1 is about referrals and new notifications. So it's part of the active case finding process. And it measures how many TB cases were referred by community health workers or volunteers in the country, expressed as a percentage of all new notified cases from country. And this reflects community contribution to active case finding in the country. Communities often reach vulnerable and hard to reach populations better than some of the healthcare facilities. And all of this helps close detection gaps in the country. The second indicator is about the treatment adherence support from community, which aims at improving treatment success rates. And it measures treatment success among those who received adherence support from community, shows impact of community-based psychological and adherence interventions. Um, and it shows that TB treatment is long and complex, and adherence support really improves outcome of the treatment. So these two indicators connect community engagement directly to core TB outcomes, which are detection and treatment success. Next slide, please. Engagement of community also goes beyond service delivery. Indicator 3 is about community representation in national decision-making and tries to answer the question whether affected communities are formally involved in national strategic plan development, TB program review, national TB report and its development, updates of the guidelines, national guidelines, and this measures institutional participation, not just consultation with community representatives. And indicator 4 looks at the level of committed funding. Funding is also important because it's important to know what percentage of national TB funding is allocated to community engagement. It includes advocacy, communications, and community engagement related activities. And this is crucial because engagement without funding is not sustainable in countries. Next slide, please. So these global indicators are pretty much aligned with our regional action plan. The actual definitions of the indicators may not 100% match with the global ones, but in essence, they are aligned with each other. So the community engagement is embedded in the regional monitoring framework and is measured through its monitoring framework. And Lisa mentioned 4 indicators that are included also in the regional action plan. And this includes adoption of standards for CSO, as community organizations' involvement in providing psychological support, procedures for subcontracting mechanisms for community organizations and civil society organizations, and the milestone which is set for 2025, which is more 60% or more member states do have these standards. This links policy, financing mechanisms, and operationalization. You may notice that the ultimate targets have not yet been set, and we plan, and these are targets for 2030, and we plan to do so during the midterm review of the strategy. Next slide, please. The framework also includes measurable service indicators, and these are indicators related again to active case finding, proportion of TB cases found through community and civil society led activities. Here, the milestone is to have at least 40% or more. And another indicator in this group is measuring treatment adherence support, and particularly proportion of people starting TB treatment who receive adherence support from community and civil society organizations. And this also could include the psychological support to TB patients. Here also we have the milestone set for 2025, which is the midterm milestone, and we don't have yet the final targets for these two indicators. And it would be really important to learn what are the results at the moment in countries to then adapt and adjust the final target for 2030. So these targets push countries to scale community-based services, to scale them up, and it strengthens the accountability at the country level. Next slide, please. On this slide, we can see how we collect this data. So we are integrating community indicators into routine reporting, and namely data collected through the global TB database, WHO global TB database. And questions include number of basic management units implementing community-based referrals, number of cases referred by community workers, number receiving adherence support in country from community, community representation in decision-making at the country level, and these are several questions assessing the representation, and also questions related to the level of committed funding, which goes to community and civil society organizations. And these are the questions that are currently included in the global TB database. And if we speak about our region, these are mainly for Eastern European and Central Asian countries who report with the long form. Because in the system we have short form, which has less questions, and long form with more questions. And focus is more Eastern Europe and Central Asia if we speak about longer form. So this is a major step toward institutionalizing community engagement within surveillance systems, and it's good to have this in the routine reporting to WHO. Next slide, please. However, there are challenges, and these challenges include the fact that there is no standardized approach used for all countries. At least previously, there was no standardized approach. We see that there is an incomplete reporting from countries. Not all or majority countries are able to report on these indicators. There are also the data quality concerns. We see that the data which is reported is of poor quality. And there is a clear need for technical support, including the TB Europe Coalition and other partners. So we believe that the way forward would be to standardize the definitions, and I know that we will hear a bit more about the initiative by TBEC and hear the examples from countries on how they managed to standardize these definitions. Capacity building for reporting, and I believe this was also done by our partners, and looking forward to hearing more details. Strengthening collaboration with civil society. It's important to scale up this collaboration, as well as improving funding and related to funding of these activities. And most importantly, community engagement must move from project-based initiatives to system-based accountability. So we expect that countries will slowly move into routine reporting of these indicators into the global TB database. Next slide, please. Yeah, this was my final slide. Thank you for your attention, and I'm happy to answer any questions if there are any questions. Over.
This is muted. Thank you for noting that. Georgi, thank you so much for that. You have shared with us this very important and interesting information from the as a representative of WHO European Bureau. So it is important to measure this contribution, to have evidence base, right? To see how, to what extent the civil society and communities are engaged in fighting TB. And thank you so much again. And now, using the opportunity, I would like to say that all the questions to Georgi can be presented very soon after 2 more presentations, but you can also write in the chat, and please do not forget to mention the speaker who you address this question to. And now, using the opportunity, let me emphasize that in close collaboration, TBAG with the European WHO office, NGOs, and community representatives and public authorities has developed the algorithm to collect the 4 indicators that very clearly describes and defines these 4 indicators, shows how to adequately estimate them, and also based on result of pilot work into 3 countries, in Kyrgyzstan, Kazakhstan, and in Ukraine for data collection. TB developed the guidelines for 4 indicators, and it comes up, it is even more detailed description, step-by-step description, with indication of timeline when it should be held, describing the issues that the pilot countries has already come across, has faced. So there is a description of how they address those issues, and they share the best practices. So you can already find a link to these materials in the chat. Please do use those materials. We have those, and we have them on TB website. And colleagues, before we move to the next session, to the next speakers, let me invite you now to start your video, so that we could record everyone, the audience here. I believe that so far we can stop screen sharing for that purpose. Great. And I will ask everyone to be patient for a minute, and my colleagues will tell us when we are done. There are many of us today, and that's nice. Nice to see those who have joined. And colleagues, please let us know when we are done. You are smiling, that's great. And that's a great moment. Colleagues, can we move on? Yes, thank you so much. Okay, thank you, colleagues, and thank you for the photo. And we will definitely share not only the presentation of the materials, but also the photos. And then we move towards the next session. This is about country experience of integration of European WHO integrators into systems of routine monitoring. So we will hear experience from 3 countries, Moldova, Kyrgyzstan, Tajikistan. And we try to make sure that we hear the vision and the prospects of NTP and the communities. So above all, let me introduce now the first speaker in this session. This is Dr. Valentina Vilk, Master of Public Health. Sorry. TB doctor of the highest category and coordinator, NTP coordinator for Moldova. Let me also remind you that you can follow the slides in 2 languages. You can choose the language that you prefer. And Valentina, we will be grateful if you manage to stick with the timing, and you will see your time on the screen, and let's go. Thank you so much, Orisa. Thank you, colleagues, for another invitation and for the opportunity to share the experience of Moldova. Right, regarding the timing, I see the clock ticking. I will try to stick with that, but that could be an issue when we speak about TB. Let's go to the next slide now. So before we start speaking about indicators, I would need to maybe start with something else. In order that a partnership between with the communities operated, above all, we need to have a good understanding what the healthcare system does and what the civil society's responsibilities are and what kind of interaction, cooperation between these two parties exists in the field of TB. Above all of that needs to be at the level of partnerships, not just some kind of cooperation, and that would cover only some specific services. I will speak about that later today, but let's go to the next slide. Okay, I'll try to stick with the time. In order that all of that work properly, we need to have the legal policy and institutional environment for community engagement. What that means, all of that needs to be stipulated in legislative acts, because as we implement new services, and the indicators, each time we see that you need to provide some rationale where that's indicated. So we have that in the Constitution of the Republic of Moldova, the law on non-commercial organizations, the law on public, and next slide, on public organizations. Next slide, please. So here, this is what every country has. For us, this is the National Strategy for Healthcare Health 2030, and it's been implemented since 2021. That sets priority 1 to 2, and this is extending the rights and opportunities of civil society, engaging local leaders and civil society. So if you have good legal framework that indicates who works and how and based on which legislative documents, in that case, it is much easier to implement various activities, because all of those activities are implemented within the national program to counteract TB. You know that we have shared experience already that we completed our program in 2025. Then we developed the program for 2026 through 30. And now it is being implemented. It is being considered by various ministries. Hopefully that is going to be the last step on this journey. But everywhere in all national programs, it is indicated that national communities and civil society need to be engaged. Oksana will speak today, but basically where we were supposed to start. They're members of the Technical Working Group and the National Coordination Council and National Councils of Experts. NGOs, they complement the national program and they provide for coverage of vulnerable and hard to reach populations. And again, to emphasize that for colleagues from other programs, here the engagement and contribution of NGOs is very significant. The experience of people affected by TB is taken into account in decision-making at all levels. So communities and healthcare system, this is about mutually supporting approach. Next slide. How we did it in Moldova, that was not very straightforward or easy, because we need to keep in mind that if you have your indicators, you can show the contribution that you've made in fighting TB in Moldova, right? And that works for everyone. That's important for the national program as well, because I mentioned that this is about coverage of hard-to-reach groups of population, and that's important for NGOs when they can show what kind of contribution that is, how the epidemiological situation changed. Of course, you must hold the analysis. I will not stop focus on that, because we have that in presentation. You see all the steps. So you conduct the analysis and then you see the situation and decide on your next steps. Next slide. So now you will see basically what all the countries have been doing there. So we have WHO indicators, as Georgi introduced. They included into the national program, not even this one, but the previous one. And I believe that we were among the first ones who have already presented these indicators. The clear partnership model that is working now. NGOs provide services plus the initial preliminary data collection, then validation and managerial decisions. Why we indicated managerial decisions? It's not about that we just make decisions. One of indicators is detected TB cases. We work on that since 2017, though if we speak about indicators, we need to cover the entire package of services, which need to be provided by NGOs. Back in 2021 and 22 with the National Company for Health Insurance, we developed it, but it's not that easy. Each time, this is about a lot of stages where you have to negotiate with everyone. So all of that needs to be indicated in orders of the Ministry of Health or the National Company for health insurance, because the services are provided at the level of an NGO, and that's funded from the Global Fund, right? Then the next step is financing the program. And this is one of the indicators that's at the national level. And if we do have indicators, if we can report on those, if we show the actual contribution, then this results in funding from the state. So without the indicators that are included into the national program is adopted at the level of the government of Moldova, and that's mandatory. And we are happy that the first two indicators, this is detection of cases and adherence, these two indicators, we work with them. We are always ready to show those figures because basically we have this transparent approach. We always engage NGOs there. And now what we have, we are by and by moving to funding. The more so that under the current circumstances, this is not an easy process, as I mentioned, since 2017, almost 9 years, but we have some success already. And in order to stick with the time, because, well, we could speak about indicators and the set of package of services. I hear the music, but let's go to the next slide, because that's very important, and that's about what's now included into the national program till 2030. So I would like to emphasize the following: the standardized package of services at the community level. Here in 2024, we had one service. By 2030, we are targeting 12 services that have been tested and implemented, and that's what's funded from the state budget and from the respective sources. And the very last slide, I will not go into detail there. This is, well, lessons learned, recognizing interdependence, integration into the national monitoring system. We have the unified monitoring system, and it is based on the indicators for implementation of the national program. Then institutionalization. Without cooperation with the ministry and the national company for health insurance, nothing would be possible. Systematic measurement of CSO contribution, and Oksana will share the actual figures, what we've achieved in the recent years. And to summarize, in the Republic of Moldova, measuring the contribution of CSOs is not only about reporting, but also that's a tool to strengthen partnership, trust, and long-term sustainability, which is very important under current circumstances. So thank you, colleagues. I took 1 minute more of your time, but that's extensive scope, right? I'll try to be brief. Thank you. Thank you, Valentina. Thank you for your always being ready to share your experience, your country experience of Moldova. And you mentioned that the country has succeeded in developing and building effective interdependence and effective partnership, basically. Yes, not everything is easy and straightforward, but as we do that, we are learning, we are developing our skills, and thank you for being ready to share the experience. And we have another presentation, then we will have a short Q&A session. So please be ready with your questions. I'm sure that the speakers will be happy to cover those. So now I am very happy to pass the floor to Oksana Rukshinyano, representative and co-founder of the National Association of TB Patients in Moldova, Smith, and Master of Public Health. Oksana will share experience of Moldova from the point of view of the community and CSOs. Thank you so much, Lesia. Thank you, Dr. Vilk, for the presentation. Thank you, Georgi, for introducing and the WHO indicators and the focus on how it's important to measure qualitatively and quantitatively the contribution of civil society. Without that, it would not be possible to move forward to progress in achievement of other objectives. And Valentina mentioned today that without measurement, we cannot prove the impact, and without figures, we cannot advocate financing at the national level. So if global donors do have certain approaches, then you don't have to prove anything, and public institutions stick with the standards, the legislation, and without measurable quantitative indicators, hoping for further financing in certain areas would be hard. And Oksana, if I could ask you to maybe move a bit closer to the microphone, or maybe speak a bit louder. Okay, so Valentina mentioned the key elements that influence measurement of contribution of the communities. We speak about the political, environmental, legislative framework, the legislative acts that impact how this engagement of CSOs and communities happens at the country level. In Moldova, we have the platforms that are key to create enabling environment to engage communities. There are formal and informal mechanisms, and Dr. Vilk mentioned the National Council for Coordination of the national programs. It includes community, civil society, governmental agencies, international organizations. We have National Commission of Experts, same composition, technical working group on TB control, and mixed technical working group for TB aid in order to provide, to organize provision of services for the both populations. And also informal mechanisms are very important. In Moldova, we have two informal mechanisms. That is the NGO platform, NGOs that are active in the field of TB, and they extended their work. They engage civil society organizations and that work in HIV as well, to avoid application of resources, to have this understanding that there should be the same reporting at the level of the national program, and NGOs that, apart from one donor, can also have resources from various sources. And it is important to keep in mind that all of these activities need to be reflected in the national program, and it would be important to show all the quantitative and qualitative indicators that are linked with engagement of NGOs. And there is a key affected population platform that brings together representatives of the communities in the context of HIV and TB in the Republic of Moldova.
I mentioned this platform several times. It is expanded. And this year we have already 14 organizations, 10 of which are active in TB. And this means that these organizations have specific funding, budgets. Of 10 organizations, 5 organizations have the experience of funding from the governmental structures. Also, these 10 organizations include organizations from the left bank of the Dniester River. This is a territory temporarily controlled by the Transnistria, but we find a way to involve these community organizations to the activities because we understand that citizens of this uncontrolled territory have the same problems with access to quality medicines and so on. And we are supporting these community organizations and motivate for the psychological support with the funding from the Global Fund. So we provide services not only to Moldova citizens, but also to the left bank citizens. And Ms. Wilk spoke about algorithms. We started with it for countries which are just implementing these standards. We are using this algorithm and we specified tasks which should not and could not be completed without the involvement of all stakeholders. And in order to introduce these mechanisms, it is important to work step by step. And for countries which are just introducing these mechanisms, please follow the instructions. You can introduce your activities and monitor these activities, and this monitoring process becomes very important. It can be updated, and even new indicators can appear in the country, but we have understood that these 4 WHO indicators are not enough to measure all the activities implemented in the country. So if you have an opportunity and if you have the capacity, you may update these indicators. Next slide, please. Now, a few figures. Within the activity of the most recent national TB program, in figures, if we talk about the number of found cases, you see the percentage here. More than 11% of TB cases were identified and referred to treatment, and this figure grows from year to year. And this meets the targets of the program. So, and we're talking about people who received support. Approximately 12% received this support, depending on the amount of resources. This depends, of course, on the territories, on the targets set for these regions. A state funding mechanism, as you see here, state allocations increased by 180%. So the budget from the state is allocated for these purposes, you see. Tariffs, it is also a very important component. So without understanding the costs of treatment and services, without calculation of all these expenses, we can identify tariffs, and it is very complicated to work without such standards and without such tariffs. And thank you. This is the last slide. I do not want to add anything to what was mentioned already. Cooperation between government and NGOs is important. Some activities should be reviewed. We need to update the indicators to scale up our activities. And of course, it is very important to strengthen the capacity of organizations. We are talking about the personnel capacity, about the competencies which should be strengthened to get the governmental support, because we are supposed to provide meaningful services on the level of the Republic of Moldova. And this is the final slide. This year, we developed 2 modules this year, which talk about the package of standardized services and about the participation of community in TB response. And the achievements in these 2 areas can influence the achievement of key governmental goals in this area. and this will help us to measure their activities. Oksana, thank you for the conversation about the experience of Moldova from the point of view of implementation of these indicators. And you mentioned several important aspects. Moldova is not a big country, but it has 10 actively working organizations, and it is a very good indicator. What is also important, why do we need algorithms? Because collection of data helps us to make decisions, because without such algorithms, we are not able to collect meaningful data and made some important conclusions about the activities. And of course, standardized services, package of services, which you mentioned, is also a very important aspect, and it should be taken into account to develop, to strengthen the capacity of organizations that provide such services. Again, thank you very much. And I am glad to open a short Q&A sessions. Dear colleagues, jumping at this opportunity, I would like to remind you, please ask questions, because now you have a unique opportunity to get answers, because there are no simple questions and simple answers. And unfortunately, Oksana will have to leave us earlier, and Georgi as well. So please use this opportunity to ask your questions. Please raise your hands if you have such questions. If you don't have questions, if you are still thinking, there is a question. Okay. So I did not find how to raise a hand. Thank you very much for your presentations. And I would like to ask Valentina about what you are talking, how you are doing this standardization. I saw the figures, I saw the tables, which I saw the funding provided by the Global Fund. How do you validate? Dear colleagues, thank you very much for this question. I already mentioned that in Moldova, we have an information system to evaluate the TB response program. It works for a long time, and our greatest achievement since last year, it was approved by the resolution of the government of Moldova. Now we are planning to use another platform for this system to combine all similar efforts. Also, in 2023, we had discussions with our colleagues and developed our TBT approach to active treatment of TB, because it is related not only to an NGOs, but also to reporting and indicators, because indicators on paper is one thing, and if you have an electronic format which you are able to check, is another thing. So we, together with the colleagues from the department, we developed an electronic registry on screening for primary healthcare facilities and other healthcare facilities. So how do we validate the data? Georgi mentioned it. We use this electronic registry for assessing, for evaluation of the TB response program. But everybody got used that it is just a nominal database, and we can have a look at the screening results, screening conducted by not only medical facilities, but NGOs as well, and community organizations. And now we can see the data. If a person is diagnosed with TB, we can see the follow-up activities. It will take some time to update the system, but it is very important. And maybe it will be useful for other countries as well. Oksana provided you data for the number of case funding statistics, and it was very important, and now it was important for the health insurance company, and there were a lot of arguments. You spend a lot of money, but where are the results? And there are some handbooks on screening, but now we have the method to calculate the number of found cases, and then we developed this. So we resolved this task on the level of Moldova. How many people can be found in the risk groups or in general population? Why I'm talking that it can be important for other countries, because you will have this question, how to coordinate these activities. You need to do these calculations. So thank you very much, dear colleagues from WHO, for these guidelines, because one can find everything, all answers to all these questions. I would like to clarify when you have electronic registries and when you input the results of screenings, and you can specify that this person was screened for TB. Well, now, when we started this webinar, my colleagues worked on the implementation of mobile screening system. And we have a question. When, for instance, this mobile system works in some village, and if there is an NGO working in this region, so it is easier to involve this NGO to work with this mobile system. And we can also specify that this case was found with the use of mobile system and with the involvement of the CSO, because there are portable methods and mobile methods to screen for TB. There are penitentiary systems which use their own devices to find cases, and data collection takes a lot of time, but it is worth doing. Thank you very much, Natalia, for your very good question. Thank you, Valentina and Oksana, for your detailed answers. Dear colleagues, there are no more questions. So, and I will use this opportunity and ask Georgi, maybe two questions to you. First question is, having analyzed what was already being said by our speakers during this webinar, the first question is, what a specific technical support can be expected, mentorship can be expected from WHO, especially in relation to the data, to the systems which are just being implemented right now, because there are lots of questions at the initial stage. And as Oksana said in her presentation, she said that, yes, there is a need to scale up some indicators, update some indicators. The question is, do you have plans to update or expand some indicators in relation to these new data? Thank you very much.
Thank you for the question, Lisa, and thanks for very nice presentations from Moldova. I think the expectation is to have exactly the work that is being done in Moldova in other countries to make sure that the indicators and the progress is measured routinely without extra systems which are outside of the existing surveillance or monitoring systems in the country. So it's really good to see this progress in Moldova, and I will closely follow this development. Related to the question on the indicators, and it's also good to see that in Moldova, it's not only those 4 indicators that I've mentioned. I think those are like key minimum core indicators that are recommended at the global level as well as in the regional action plan, but it doesn't mean that we limit the indicators to those 4. Of course, countries are welcome to adapt and include more detailed and indicators relevant to their national context, because context may be different in different countries as well. So I would say those four are minimum indicators recommended by WHO, but it's not limited to those four only. As to your question regarding support, so mainly the support is in the form of technical assistance from the regional office as well as the global team at HQ. So in case country has any issues with adaptation or have any questions, of course, you are always welcome to approach the regional office directly, and then we'll take it from there and identify necessary sources as well as people who could technically support countries. So feel free to approach us directly in case you need any support in this direction. Over.
Thank you very much, Georgi, for this answer. Dear colleagues, if you don't have any more questions, let's continue our session. Dear Valentina Vilk, so please be with us. Maybe there will be questions during the second Q&A session. And thank you very much, Georgi, Oksana, and Valentina. And I'm very pleased to give the floor to Kyrgyzstan that will share their experience on the same issue. And I give the floor to Dr. Gulmira Kalmanbetova, an esteemed doctor of Kyrgyz Republic and Deputy Director of NTP. So you're welcome. The floor is yours. Good morning, dear colleagues. Do you hear me? Yes, we hear you well. Yes, we hear you well. Good morning, dear colleagues. Yulia, Lesia, thank you very much for invitation. I am glad to share the experience of Kyrgyzstan on how we implement these four indicators and integrate these indicators into the national system of monitoring and evaluation. And I would like to say that this presentation is prepared together with my colleague, but she was not able to. So how we implement these four indicators of the WHO European region? How we implement it in the system of national monitoring?
We would like
Next
to
slide,
share
please.
an
And
event
we would like to
that
share the
happened
information about the
for
event
us and Yulia
in which
Lesia.
Yulia and
They
Lesia also
participated online.
participated in
They
the online
couldn't travel to
regime.
join us, unfortunately,
But
but
in
in November
November
2024, a
2024, we
forum
had a
was
forum on
held
multi-sectoral
on multi-sectoral partnership for TB elimination in Kyrgyzstan. So how was it special? It involved representatives of the legislative authorities, that's the representatives of the parliament. Also, there were representatives of Ministry of Health of the Republic, together with the Fund for Compulsory Health Insurance. These are the institutions that finance implementation of the state social contract. And this will be discussed in more detail by Natalia Adilanem. And of course, NGO representatives were actively involved, those that work in the field of combating TB. Also, representatives of primary healthcare were invited, and I believe that my presentation is going to be much kind of shorter because Valentina mentioned the importance of integration of NGOs in the public structures to provide services to those who suffer the disease. Let's go to the next slide. In this slide, you see our country. Now we use to report to Stop TB Partnership on implementation of the project for active case identification, investigating contacts, and working with case managers. Moreover, we also would like to express gratitude to those NGOs that are listed on this slide. Natalia Vladimirovna will speak in more detail about the work that is being done. We have a branch office that is also contributing to implementation of TB activities in our country, TB people. With them, we are now trying to restore active work, because in our country we lost Dilshad Haitov, unfortunately, he passed. And also Association of Family Doctors and Nurses, they are also being actively engaged in the activities that are being held in the country, because I will speak about that. We have the significant issue of TB doctors in distant regions, even in district centers. Most of them are of retirement age. And now even at the level of the Ministry of Health and the Fund for Health Insurance and the group of activists from that organization, we are all working to transfer some functions to the nurses who can replace the doctors that are not available. There is very active work of Ganesh Foundation, Door Media, and they have started actively engaging young people. I mean, NGOs who work in our country, health and education of youth in 21st century organization in particular. We also have NGO Positive Youth, and also the National Red Crescent organization works. Red Crescent Society Plus Center, TIES Plus 2, Kendash, Uluk Mandariga, they are supported by an UNTP project, and they work on the contract of the Global Fund, and there they provide very significant support. And I should also note that in our country, in the recent years, we see significantly better communication with the non-governmental sector. Next slide. Here you can see how we cooperate with NGOs to fight TB. We are in contact. We work directly. We also contact them via regional TB centers and via TB officers at the primary care level, because in our country we have individualized national registry to register medical information system, so MIS, and NGOs, when they will come and work with primary care, the doctors must indicate what kind of services that they provide. In this way, we are trying to systematize our work with NGOs. Next slide. Here you can see the algorithm for data collection for the 4 indicators. I will show you indicators 3 and 4, and Natalia will present indicators 1 and 2. We can go to the next slide now. I believe I will skip that because it was presented in a lot of detail by Georgi. Let's go to the next one. And next. So now, if we speak about the indicators on interaction with the civil society sector and communities in 2024, based on the MIS system data for indicator number 3. Yeah, I hear you. Thank you. So we got the 14%. I mean, that's the contribution of NGOs in detecting active identification of cases. So the contribution is being improved. And also the engagement and working with those people who are lost to follow up. This indicator, due to implementation of the project, GSI project, we will prevail over TB. This is the Global Fund supported funded project with UNDP. Now it is higher and it is 33%. I will try to go very briefly. So the challenges now. We have not yet developed the reporting forms to work with NGOs, rather limited rights to access the process for registration of services. I mentioned the elderly advanced stage of healthcare professionals and low level of awareness. That has negative impact on work with NGOs. Next. And the suggested steps to improve the situation. Well, of course, we are working on that already. The reporting forms are being developed. We will try to implement them in practice. In the TB registry database, together with our IT team, we try to automate drafting of reporting data on the number of services provided by the NGO sector. And also we are training the nurses to support doctors. As mentioned, on a regular basis, there are trainings for healthcare professionals, especially at the primary care level. On that, it is necessary to register NGO services. So now we are looking for funding to develop and implement an additional module to reflect work of NGOs and analyze their contribution to implement TB activities. So we expect that as a result of the implementation, we will have increased completeness and quality of registration of services provided, reduced data discrepancies, of course, increased reliability of reporting, which will make it possible for us to show systemic impact of interaction with NGOs. And of course, it will help us to implement the action plan of WHO. And I guess that's it from me. Next slide. Yes, this is thank you slide. And in the bottom, you can see TB Centek in G. This is our website where everyone who wishes can go, looking for the required information, in particular on cooperation. Here on our side, we are very grateful to you for sharing your experience and the perspective from NTP. We see that there are some challenges which were also mentioned by Ms. Wilk in her presentation. It's so good that the country is doing its best to address those issues. And without further ado, I pass the floor to Natalia Shumska. She is our partner. She also was engaged in the data collection pilot work, and she is the director of Rock and Roll organization. You are welcome, Natalia, and we will be very grateful if you stick with the time. Thank you. Thank you for the opportunity to share, to have this retrospective analysis. While I was listening to my colleague, I understand that the quality aspect is technical support from European TB Coalition. They came in our country in 2023 and they suggested that we conduct this data collection. And that was possible because you know that there was a change of management in the National TB Center, and those people are very open to that. The team, the leaders, they were open to have this dialogue with the NGO sector. Next slide. And speaking about this experience, we are speaking about that previously for NGOs. NTP received maybe like just fragmentary reports that could somewhere at the national roundtable could be shared by donor organizations, because NGOs, they received their grants and they reported to the international donor community. So when this process started, it made it possible for us to bring together the partners, the donor organizations or international NGOs and civil society organizations, communities, in order to show, well, that everything matters. NGOs, we believe that we do a lot, but that's true, because when we find them, when we motivate people to undergo treatment, if they were lost to follow up, we also try to do a lot. But NTP not always says how this data could be recognized, that this work is being done and that has impact on control of TB in our country. So that is why we started this dialogue. And first we conducted the mapping, and we provided, so there was a joint working group, there was an NTP expert, and we conducted working meetings, and official letters were sent to USAID leadership, to UNDP as the principal recipient, and the international organizations, the NGOs that received, for example, funding from other sources. And in this way, this query or request was submitted on collection of this data. And there were these debates where a lot of people said that they would not like to provide the data, that they said that we could only provide cumulative overview, and some donor organizations, they supported activity of clinics and provided further support. There could be duplication of data, but all in all, as a result of our meetings, donor organizations did find this opportunity to provide the data to the team who were engaged in this process, the algorithm for data collection on the 4 indicators next. And this is the extended meeting that took place, next one. So speaking about the experience, it's very important to have these dialogues and meetings and explanations to show the algorithm, data collection algorithm, to make sure that these processes are transparent. Now, the fruit, the result. That's about the enhanced coordinating role of the National TB Center among the stakeholders, because they complained about that. The data were not provided, and they shared this data. We don't know what they are doing. And this process made it possible to have a more complete picture of all the stakeholders there and organizations, civil society organizations that were engaged in the process. Speaking about the first 2 indicators, we speak about that in the country. We have standardized operational procedures, that cover services provided by NGOs. And there we conducted the desk analysis of all the legal document services provided by various organizations and how they were regulated. So there were standards of medical and social services, but in our country they were revised several times. But we had them in place, they were defined, and based on that, well, that's also the entire process that gave the impetus to that. The National TB Center announced the contract or the services that were relevant, and then there was the respective procedures, and this work was implemented by a consortium of organizations, and certain topics for reflection, what should be done there in order to make sure that this data can be collected and verified. Most as a result of that, it was possible to develop cooperation with with regional coordinators. So that was very important. Accountability, as we mentioned, so according to the guidelines that were implemented, European coalition. So all of that made it possible to introduce this information to partners, and all of that open, the data were consolidated, and the decisions were made. And the next slide, as mentioned by Ms. Gulmira. So as a result of all these discussions, basically we asked the question about validation, and there was the suggestion to include into the registry, TB registry, the button that would make it possible at the primary care level to indicate with the support of which organization a certain service was provided, active screening or psychosocial support. And also, as mentioned by Gulmira, well, this is about time. Not everybody has good awareness of that. So in order to see the objective situation, it is important to make sure that it starts working. And next slide. So where there is this regular data collection for indicators 3 and 4 as well, that show the impact of our activities, the engagement of civil society, that is very important because first we know the scope of services provided, we can plan for that. Also, the National TB Center can coordinate donor assistance, and we have worked on the country application, and where we have the data, we can include that into the country application, or we can plan the budget for the public contract. And next slide. So it's very important that civil society organizations are proactive, that they are engaged at all the stages of implementing those indicators from the first meeting within NTP, when we say that this process is initiated, to completion. And we know that it should happen on a regular basis. So this is an ongoing process, and the engagement and of representatives of the communities, that's also very important, so that they could impact decision making at the national level.
Natalia, thank you very much for sharing your experience and the experience of direct data collection, because these indicators, quantitative indicators, slightly differ. So you had qualitative indicators, and approach to data collection is slightly different. Thank you very much. And we're now switching to another very important presentation. Now we are going to listen to the experience of Tajikistan. It is a fresh experience because the country has just introduced these indicators last year. And this year they were able to conduct the first data collection. I give the floor to Dr. Babakhajayev, Chief TB Doctor of the Ministry of Health and Social Protection of Tajikistan, and the former director of National TB Program. And please mind the time. Thank you. I hope that we will not hear the music during my presentation. Dear colleagues, first of all, I would like to express the gratitude to the organizers of this webinar. For us, it was very important to listen to the experience of Kyrgyzstan, Moldova, as Lesa mentioned, we are following the steps, and my presentation will be shorter, and I would like to focus on the questions which were formulated by you. Next slide, please. Here, we formulate the question why it is necessary to measure the impact of society's NTP response and which decisions improve the data collection. The impact of civil society organizations help to evaluate the achievement of the targets of the Millennium Development Goals. I calculated the percentage. Our task was to reduce the TB incidence by 80% by 2025. And we are supposed to achieve 12.1% of cases per 100,000 population. Right now, we achieved only 34% of the tasks. And the second task was to reduce the number of TB-related deaths by 90% by 2030. And we were supposed to achieve 0.4%. And the task was to reduce the number of deaths by 75%. We almost achieved this indicator. So our achievement is 74.4%. So, and we understand that in addition to NTP, in addition to governmental facilities, medical facilities, the influence and impact and contribution of TB communities and TB response is very important. And we need to evaluate this engagement. Here you see these 4 WHO indicators. And as we see, we need to integrate them into the routine monitoring without the parallel reporting. And I heard from the previous presenters from Moldova and Kyrgyzstan. And of course, we need to also introduce new variables into the electronic registry. We should take into account the data from the primary healthcare facilities, such variables as method of case finding, active or passive, who found the case, a primary healthcare facility, TB service or civil society organization. Next is treatment adherence, and we need to specify the type of DIT, OT, or VST, or family supported treatment, kind of psychosocial support, counseling, material support, and so on, and the funding sources, state budget or funding from the development partners. And we understand that in Tajikistan, we need to increase our activities. And we have the program NTB Tajikistan activity, and these activities include 8 NGOs at the local level, and they are working directly on the implementation of this project. And we try to integrate this routine monitoring and into our electronic register. Next slide, please. Here is the question how to use the data to strengthen partnership between NTP and CSO, civil society. I would like to tell you that our National Coordination Council at the government on HIV, TB, and malaria also includes 4 civil society organizations. It is a TB partnership, gender and development, AIDS Plus, and Tajikistan network of women living with HIV. And they actively work at all meetings of the committee, and they help to promote the national coordination mechanism activities. We have 19 civil society organizations in the countries which are involved in the TB program, and they have experience in active case finding and the support to strengthen treatment adherence. I do not have enough time to specify the contributions of each organization, but in general, they support the activities of the National TB program. Also, every year, the Ministry of Health announces the contest to provide grants to CSO to strengthen active case finding and treatment adherence strengthening to treat people affected by TB. So, and all of the mentioned organizations, CSO, received such funding. And also, I would like to tell you that every year, representatives of the National TB Caucus show stars, community leaders who are TB ambassadors are involved in the activities to inform the population, to reduce the stigma and discrimination, and to increase treatment adherence for people with TB. And in general, it is a great contribution, and we would like to evaluate the contribution of all these organizations of this army in TB response. Next slide, please. This is the last slide. And I would like to tell you in conclusion that the experience of Tajikistan in integration of these 4 indicators related to TB community and local communities in the system of routine monitoring, we are just making the first steps, and we are very thankful for the data which were presented today. And for us, it is a roadmap on how to move further. Thank you for attention. Dear Dr. Tom, thank you very much for your presentation. Thank you for your experience. And thank you for the readiness of your country to move forward. Dear colleagues, we are now moving to the Q&A session. Unfortunately, we are slightly behind the schedule. And dear speakers, maybe if you have 10 more minutes, and if you are ready to answer questions of our participants, let's do it. If not, then, dear participants, you always have an opportunity to think about this information and send us your questions with the name of speaker to which you address your questions, and we will ensure that you will receive the answers. And I see that there are no questions from the audience in the chat. I also see that there are no questions in the chat box. So, dear colleagues, dear participants, so this is the end of our today's very interesting and useful meeting. And I'm sure it provided you with a lot of information for analysis and review, because we are now just in the beginning. Some of you are in the beginning of this road, others already have some experience. And so we spoke about these 4 indicators, but our speakers told that these indicators can be adjusted, adapted to the context of the countries. So we need to look at it in a comprehensive manner. And in conclusion, I would like to say that the work on these 4 indicators in the WHO European region demonstrates that what is measured becomes a priority. And thanks to the partnership and adherence to increase the rights and capacities of communities, we see that it will help in our regional and local activities to eliminate TB in the region. And I see the raised hands. Sergey, you are welcome. Hello, everybody. Thank you very much for information. Thank you very much for the useful experience. But I would like to focus more on maybe I would like to get more support to the countries which have come complicated problems in collaboration with the NTPs, where it is complicated to involve communities in TB programs. And as soon as it is initiated by the WHO regional office, so these countries also are supposed to implement these functions, the mentioned functions. These countries and the executive bodies, maybe it is possible using the authority of the regional office of WHO to activate the dialogue in the countries with the help of the national offices of the WHO to lead these efforts, to combine these efforts to establish dialogue with the NTP, communities, civil society organizations. As soon as we as a community, for us it is rather complicated to advocate it. It is good, it works well in the countries where the governments understand it, where they understand the importance of the civil society involvement and engagement. So it is rather a comment. Well, maybe it is possible to find some variants to involve WHO to promote this. Yes, I also thought that Valentina possibly will be able to answer this question. Maybe Natalia will answer this question. Here, it is important to understand the WHO develops the framework, and all the countries which sign this framework agree to these indicators. On the level of countries, possibly we have colleagues from the regional WHO offices who know how this WHO structure works. It is important to underscore that when WHO develops recommendations or indicators, it is important on the national level to have somebody who would undertake the initiative and promote it, or at least start speaking about it, because finally it brings the result. But first we need to understand the question, the issue, what should be measured with these indicators. And possibly it is possible to find some partners on the level of the civil society organizations. Possibly you can write some joint letter, and maybe this letter should not be addressed to the country offices, because advocacy is the responsibility of the civil society, not of the regional and or country offices of the WHO. And maybe Valentina can support it. And if these issues are not raised by the CSOs, maybe these indicators would not be developed. But maybe you are thinking how to take into account the interests of the civil society. So if the organizations and civil society and communities would not raise these questions, maybe this all would not be possible. I think that advocacy is similar in all countries, despite all challenges or barriers that exist in the different countries. But if you combine the efforts, not only on behalf of one organization, but on behalf of all organizations, because these efforts are applicable to all diseases, to HIV, to malaria, to TB, because I know that there are many partners who work not only with TB. So Valentina, if you have something to add to it, but my answer to Sergey is that you need on the level of the country to combine, to unite efforts with other organizations, to show that your contribution should be measured and evaluated. Maybe you should initiate dialogue discussions with the NTP and other organizations, or maybe you can use the capacities of other organizations that have an opportunity to talk to NTP or other partners which you would be able to involve And possibly WHO will be a useful partner if, for instance, if you write a letter and ask WHO to initiate this discussion on the country level. So if possible, if I may, so I should say a few words in addition. Dear colleagues, so in Tajikistan, we do not have experience in cooperation between CSO and NTP. And you introduced me I'm a former director of NTP in Tajikistan. And we identified 3 national coordinators for each component of the national TB program. We had a coordinator for the collaboration with the communities. And this was the link which helped us to accumulate and summarize all the activities with the civil society organizations. And I can tell you that we are now on the right direction, and integration in the routine monitoring will help us to establish this coordination mechanism. And if you allow me, I would like to add, I understand what Sergey is talking about, because we collaborate on different projects. And what Yulia recommended, maybe you should unite efforts with other organizations and step forward on a broader front. And you have the representative office of WHO in Uzbekistan, and maybe you can write a letter on behalf of your network and other organizations to WHO, to your country office, and write what concerns you. And I agree that it is very important to get such address, such letter from you or from your network. It is important sometimes to get the support from the regional WHO office. That is why Sergey is asking about. I understand you. So, and I will finalize it on the positive note. So I always speak with all presentations. Not everything is so easy. And it is not so that I would like to do it and tomorrow I have it. So we have also rather complicated relations with NTP in the very beginning, because civil society organizations do not replace the health network. And we should understand that this is a question. Collaboration brings the results to everybody, to medical organizations and to CSOs. And we should understand that in the end, everybody wins. So we can write letters to many other partners to ask them to participate. I do not know whether it will bring positive results immediately until these organizations find the common ground with the national TB programs. If we talk about today's webinar context, indicators clearly demonstrate that this is a contribution of CSO, which led to these or that results. And I would like to tell you that NGOs and CSOs can achieve a lot. But I would like to tell you at once, we also started from this. Yes, we want this. Of course, okay, but how can we do it? The same standardized service package, which we were talking about in the beginning, it was initiated by the CSOs and NGOs. Then we joined them as a national TB program with our vision. And if the CSOs do not contribute anything and just come to us, we have. So you all have your wishes, but you need to implement your wishes. But we as a national program often see that when CSOs come to us with clear tasks and explanation how they are going to achieve these tasks, we support such initiatives of NGOs because we can see the result of their activities and of these initiatives. And openness is very important. We should constantly discuss it on the open platforms, in the technical working groups, in the National Coordination Committee, and then there will be no misunderstanding. So this can be achieved, not immediately, possibly. So I can put myself in the shoes of the other national TV programs. Everybody goes through this. And in the end, everybody understands that collaboration brings the results. Ask our NGOs, civil society organizations, how they develop their way. But everything can be done. Everything is resolvable. Send your national TV program managers to Moldova, and we will show how it works in reality. Remember, Yulia knows when people visit us, their attitude changes because they see the results of our activities. So send your representatives to us and we will show you them how it works. Thank you, dear colleagues. We have one more question from a participant, and let it be the final question for today. Thank you. And the question is from Nels for the Cruz. Carta, a question from the TB Response Fund from Netherlands. How this data will be used to get funding? What percentage of the national funding is allocated to the local level? And I think that this is a question to all of you. Maybe you will be able to answer. Maybe one way, Valentina, if possible. So once again, how much money is allocated or how it is allocated to the local level from the state budget? The question was how much money from the national funding is allocated to the local communities for their activities. What is the result? So it is calculated. It is just a drop in the sea, so to say, but I will explain how it works. So it works better and better. First, funds were allocated for screening, and in the beginning, the screening activities were covered by the Global Fund primarily. But every year, this situation was improving, and every year, the state funding was increasing. Now it is for almost 5 million Moldavian lei. It is from the national TB program. And in the national program, you show the budget funded by the Global Fund. And another part of budget is from the National Health Insurance Company. So it is maybe a recommendation or support to the colleagues from other countries because they can use such approach. And we compared these funding amounts. So this almost 5 million lei were to be funded by the National Health Insurance Company. And what shall we do with the Global Fund financing? We will have only 1 year. We have only 1 year left for this Global Fund funding. And this is for 5 million. And in principle, in a year, it should be financed by the National Health Insurance Company. And the Health Prevention Fund identifies priorities each year. And it includes not only our TB program, it includes other diseases, vaccination, immunization, and all the programs should convince that their activity is a priority. And this defines the amount of funding. And everybody should convince that their activity is efficient. Until this year, until this moment, we were very convincing on the basis of screening results. We had a standardized package, and we wrote that not only screening should be funded by the global fund, by the national health insurance budget, and other programs also. Thank you, Valentina. And I think that Nistan has joined us. Thank you. I'm glad to see you. Maybe you can also answer the question, but please, not more than 5 minutes. Okay, Alessia. Hello, colleagues. I'm glad to see Yulia and Alessia and all of you. I will be brief. How these activities are funded in our countries by the government. We have a law adopted in 2017, the law on implementation of the social order, social assignment. In 2023, we submitted a project to find the lost to follow up patients. These are people who had inefficient treatment outcomes, people with high risk of being lost to follow up. And the government financed these activities in the amount of 5 million soms. This amount is not constant. It can be changed depending on the context, on the situation. Also, in our country, tariffication levels are being changed, and the standards of services provided by the NGOs are also funded, and salaries are being increased, because in the past it was a limiting component because the salaries were low, and now all the salaries are being reviewed and the standards will be updated in NTP. And NTP is planning to organize and implement a tender, a contest. And in 2026 and in 2027, a new social project will be announced by the government, and we expect the governmental funding. And in principle, maybe that is all. Thank you very much, dear colleagues. So we have a very interesting discussion. Thank you to all participants that you are still with us. And I think that we will close our meeting. And again, if you have questions, please write, and we will help. We will try to get the answers from the speakers. Once again, I would like to thank our esteemed speakers for their presentations, for your experience, for your active participation. I would like to thank our interpreters who helped us to understand each other, and we wish you a wonderful end of the day. Goodbye. Thank you. Thank you. Bye-bye.